Hi, my name is Pat Iyer, and I am the editor of the fourth volume of Medical Records Analysis. I'm pleased to introduce to you Christine Dorman, who is a critical care nurse practitioner. Dr. Dorman is the author of one of the chapters in the book. Christine, would you tell our viewer, please, what topic did you choose?
Thank you, Pat. My topic is on delayed stroke recognition, the legal exposure for the nurse practitioner. And I chose this topic because I wanted to highlight what happens when a delay or misdiagnosis of a stroke can result in a catastrophic injury.
I know for our LNCs and attorneys who are going to be reading this book that they're familiar, as we all are, with people who've suffered strokes and have had permanent loss of function, of speech, and yet there are others who are quickly treated and the treatment is appropriate to the type of their stroke, and they can come through with barely a deficit, if any deficit at all. How does the fast treatment of strokes impact the liability? And do you cover that in your chapter?
Thank you. That's a great question. I do highlight that the different screening tools that are utilized to recognize strokes in a timely fashion, not only in the outpatient setting, but regardless of the setting, whether you're a nurse practitioner or clinician, if the appropriate screening tool is not utilized and timely recognition of stroke-like symptoms are not recognized, that delay can result in a catastrophic outcome for that patient. You basically want to set your patients up for success. Once you identify what the symptoms are, what are your next steps? You want to get them to the appropriate stroke-ready center. You would like for them to have the appropriate intervention. Time is brain. They need to be undergoing a scan, whether it's a CT imaging or whether it's an MRI. Do they need to have further intervention? Is the facility that they were taken to have the availability for a neurointerventional radiologist, that they're able to undergo a thrombectomy if they're not a candidate for the clot-busting agent, the reperfusion therapy? All those are important keys for that provider to recognize what needs to happen. And as legal nurse consultants, we can help the attorneys decipher if the patient received the appropriate treatment. And in my chapter, I highlight that in the case study that I utilize of a patient who sustains a massive subarachnoid hemorrhage.
There's a lot of details and a lot of tips in Christine's chapter as she focuses in on the appropriate diagnosis and treatment and the liability that a nurse practitioner can be exposed to. Be sure to get a copy of this book, Medical Records Analysis, Volume 4, at the link right below this video, which is LNC.tips/MRA4. Thank you, Christine, for sharing your tips with us and most importantly, for writing that chapter.
Thank you, Pam.